Welcome to today's episode of the Medical Fitness Podcast, powered by the Medical Fitness Association and MRF Institute. My name is David Flench, and I am the president and CEO of the Medical Fitness Association. I'm co-hosting this episode with Jeff Young, adjunct lecturer at CUNY York College and co-founder of the Medicine Rehab and Fitness Institute. Hi, Jeff.
Hey, David, and hello, everyone. We are very excited to have with us today on our show Dr. Cedric Bryant, Chief Executive Officer and President of ACE, which is the American Council on Exercise. Cedric leads ACE with a focus on science-backed education to support health and exercise professionals, utilizing emerging fitness technology, championing inclusivity and diversity, and sharing quality information to help all people develop long-term healthy habits and keep people moving. He has a master's degree in exercise science and a PhD in physiology, both from the great Penn State University. He represents ACE as a national and international lecturer, writer, and expert source. Cedric, thanks so much for being on our show. I'd love for you to start by sharing more information about your background with our audience.
Sure. Well, first, thanks for having me, Jeff and David. I appreciate the opportunity. It's always great to chat with folks that I've actually followed over the years and have been admiring your work as well. So I thank you for your contributions. So my background, I would say the easiest way for me to describe my background, it's really been in three large segments, basically. The first segment was kind of the traditional kind of academic route where as you stated, I received my master's and PhD from Penn State, and I then went on to teach and do research at a couple of institutions. I was at Penn State, West Point, which was a unique opportunity for me, and then also at Arizona State, where I did a lot of research focused on looking at exercise and physical activity as an adjunct to therapies for individuals who had intermittent claudication. And so that was really my focus, was looking at how we could utilize exercise to address a variety of chronic health conditions. And as a result of that research, it kind of led me to my second segment, because part of one of our research studies, we looked at using the Stairmaster exercise product, which was pretty popular at the time. But for those individuals with peripheral vascular disease, the normal standard Stairmaster was too challenging. So we redesigned the Stairmaster so it would start at a lower intensity and go up by smaller increments. And that created my connection and association with the folks at Stairmaster, and I was asked to come join them to work in their R&D department. And being a person who had always been just around academia and not really in the kind of for-profit business world, I was a bit hesitant. So I took a year's leave of absence from Arizona State to go work at Stairmaster in their R&D, and I loved it. And so needless to say, I didn't go back after that year, and I stayed at Stairmaster for a little over a decade, working on product development. But the neat thing about the ownership at Stairmaster, they were really interested in science and research and really understanding the various applications of the products, and that's what I got a chance to lead for more than a decade. And during that time, I was asked to serve on the scientific advisory board for ACE, the American Council on Exercise. And that led me to where I've been now for the last 20 plus years, working with ACE and helping to develop educational programming and really try to help the organization live out our mission, which is to get people moving. And one of the things I will say about the mission, we try to keep it simple, but I think sometimes it misrepresents what we mean by getting people moving. It's more than just about exercise and physical activity. I like to think of it as getting people moving in the sense that they are adopting and maintaining healthier lifestyles, where movement and exercise is certainly a critical component, but there are other aspects: sleep, proper nutrition, management of stress, all those things are important if we're going to be our best selves. And so that's how we like to kind of think of getting people moving, is moving toward adopting and maintaining those overall healthier lifestyles.
What a great background, Cedric. That it's impressive how you've moved through, and we'll dive a little bit deeper into this.
Mm-hmm.
So, 20 years, more than 20 years at ACE. So I think it's chief science officer, and now this summer you took on the full role of chief executive officer, so leading that organization from the very top. I'd like to hear about some of your accomplishments, and it doesn't have to be just limited to ACE, but at ACE, any of the things that you're most proud of in your work, and maybe then go into some of the initiatives as CEO now for ACE as an organization that you're looking at.
Sure, that's a healthy question there, David. I'll do my best here. I would say, boy, in terms of some of the more noteworthy or accomplishments that I'm probably particularly pleased about, I think in general, kind of advancing evidence-based fitness practices, uh, being able to integrate scientific research and into fitness programming in a digestible manner. I think one of the things that I've always strived to do is to make the science approachable to the practitioner, because I think oftentimes the practitioner isn't going to necessarily read the journals and the studies that you or Jeff or others might be able to have access to and resource and understanding. But I like to see one of ACE's fundamental roles and contributions is being able to translate that science in a manner so that it's approachable and usable by the practitioners who are out there in the trenches, really making the direct impact and difference in the lives of people in terms of helping them to move more safely, more consistently, more effectively. So I'd say that one is really near the top of the list. I would say championing public health initiatives and policies, because I think one of the things that unfortunately happens in our space is I don't think our space receives the respect that it deserves. And I think one of the ways in which we can do that is through smart partnerships and helping those who are adjacent to us really understand who we are and what we do and what we can add. And so I've been happy to be part of several initiatives with the WHO, the CDC, and those organizations are starting to clearly see the beneficial role that health and fitness professionals who are appropriately trained, who conduct themselves in a professional manner, can bring to the team, if you will. Because I firmly believe that optimal healthcare and the optimal delivery of public health is the ultimate team sport, in that you have many different players playing different positions. You have physicians, you have nurses, you have nutritionists, you have uh, personal trainers, various other exercise professionals, psychologists, all working together to provide, I think, the best care for folks. And so, to me, being able to be a part of initiatives like Active People, Healthy Nation, which is a CDC initiative, where the goal is to get 27 million Americans moving more by the year 2027. And, really the evidence is overwhelming that if we can get more folks moving, we will have a significant impact on our population health. And so it's nice that we've taken the time over the last several decades to amass this strong body of evidence to support the value of being physically active. The pandemic just further proved that, in that there study after study has showed that those individuals who were in better physical condition tended to fare better when dealing with and encountering the COVID virus. And so I can't think of a condition where being more active, more fit doesn't play some type of a beneficial role in helping you either more effectively manage that condition, prevent the condition, or in some cases, actually reverse the condition.
Yeah, man, I want to at some point here in the near future dive into your background even a little bit deeper, but I want to comment on something that you just said since it's
Mm-hmm.
near and dear to my heart, and I'm also just curious your opinion on it, and that is what my partner and colleague Thomas Hammett and I talk about a move more versus fitness continuum, where it tends to be in this polarized world we live in, polarized, where some people, their pendulum leans, I'm just giving my views, leans a little bit too far towards let's just move more. And other people know we need to exercise. And I tend to be a sweet spot person where it's in the middle and that we really need to encompass all. And you said so much over the last few minutes, like even with you alluded to ACE and really lifestyle medicine and just moving
Mm-hmm.
more into, so you actually even broaden that a little bit. So it's not just about physical activity and exercise, it's moving more towards better sleep habits and better nutrition
Mm-hmm.
habits and stuff like that. But focusing back on the whole move more versus for lack of a better word, exercise continuum. And just what are your views on that? Like, I don't really know how to answer to ask that question. But what are your views on that continuum and how, whether it's a fitness professional or a healthcare professional, how should we look at that continuum and where do we start people and how do we guide people through it?
Mm-hmm.
Maybe to, because you talked about the importance of fitness, which is, that's my big thing. Moving more is great, but sometimes moving more doesn't really improve your fitness outside of like a beginner level. So in any
Mm-hmm.
case, with all that as a background, I'd love to hear your response.
Sure. A couple thoughts, Jeff. One, I agree with you. I think it's unfortunate in the world that we live in that everything is so polarized that it's either or as opposed to a both and. And I'm a firm believer that the idea of a continuum is how I like to look at things. And I kind of look at that continuum from uh, I'll call it function, health, fitness, and performance. And we want to ideally move people along that continuum, going left to right, if you will, from function to optimal performance, whatever that is for you as an individual, because we all have different needs. And I think that's where it's important that you have to start with really understanding the person you're working with, because they're going to fall somewhere on that continuum. And it's important that you start them at the right spot on the continuum and then progressively move them along the continuum so that they can really experience the full benefits of being more active and moving more. And moving more to me is the way of getting people introduced to activity, and then hopefully we can eliminate some of the fears, the hesitancies, the barriers, and move them into actual programming. But I think one of the things that happens sometimes is you'll have folks who are on more on the fitness performance side, and they might be a little too aggressive with that person who's just starting out. But at the same time, we do people a disservice if we don't gradually and progressively and appropriately challenge them to continue to improve and move along. And that's why I'm going to be speaking at the MFA conference, and that's what I kind of talk about as kind of being part of the art and science of exercise programming. Is that you've got to really know your client very well and kind of use experience and intuition combined with science, research, and evidence based practices to really provide them that optimal prescription, if you will, to move them along the way. And I always like to tell people some activity is better than none, but more is better than some. And so, yeah, it's great to get the person who's not doing very much to move more, but we really want to get people to, if they can, start to think about trying to challenge themselves at an appropriate level and progress that challenge as they adapt.
This is actually making me realize that we have two parallel continuums, what we just talked about, and then the stages of behavior change, which
Exactly.
you're a huge fan of. And David, I don't think you know that the way I met Cedric, well, actually, Cedric, you might not even know that the way I first met you was at an MFA conference back in 2015. You were speaking, and I was introduced to you very briefly, like a handshake,
Mhm.
by Dr. Rob Gottlieb, who brought me there for the first time. So in any case, that was a very brief, and then flash forward to like maybe 2017, through the American College of Lifestyle Medicine, and I was, the chairing the fitness, was now called the Fitness and Medicine Member Interest Group, and we started talking, and then and David, you'll love this, or maybe you won't, that when I was made chair of it was actually the founding chair of this group, and I knew that the American College of Lifestyle Medicine was strategically partnered with the Medical Fitness Association, American Council on Exercise. So I knew I needed to get on the phone with some people. And it was actually Cedric that I chose first because of our Penn State connection. So I knew that we could talk about Penn State and how great we are and football and all that stuff.
We
And in any
connected right
case,
away.
that's exactly right. So in any case, and then you introduced me to Jessica Matthews, Dr. Jessica
Mhm.
Matthews, which was, and ironically, at the same time, I'm meeting who are now my co-founders and partnered with the Medicine Rehab Fitness Institute, who are also amazing with behavior change. And so all this is happening at the same time. I knew nothing about, the stages of change and the importance of this continuum. So in any case, I'm going on too much, but your comments made me realize, oh, there's two
Mhm.
parallel continuums, and professionals, whether it's healthcare providers and or fitness professionals, really should become familiar with both, so that where, from a behavior standpoint, to optimally place that person. Well, for lack of a better way of describing it, and
Mhm.
then to use that skill set to help move them forward. So go ahead and speak to that. I would love to hear your thoughts on that.
Yeah, well, it's funny. If we look at the data objectively, um, we have not been very effective at getting large numbers of people to move on a consistent basis. Um, we every time the reports come out, it's always, we've got to do a better job. We've got to do a better job, and I think for many decades we've tried to bludgeon people with the science, if you will, in terms of all the reasons why you should be moving, and I don't think that's the problem in convincing people that movement and exercise and physical activity is beneficial for them. Because if I were to conduct a little survey and I were to ask people, do you think being physically active and exercise and moving is good for you? If there were 100 people in a room, I would say 90 plus of those folks would raise their hand and say yes. And then if I were to pose a second question, well, how many of you are exercising on a regular basis? I would probably get 20 to 25 of those 100 hands to go up. So what's the disconnect between the 90 plus and the 20 to 25? I think it lies in behavior change, because being active and exercising is a very difficult behavior to get people to adopt and change, because there are a lot of barriers and factors that get in the way. And so that's why I think one of the things that's going to really help us to move the needle is what you're alluding to, is really um, applying behavior change science to our practice of training people in exercise and fitness. And that is really one of David had asked earlier, what is some of the areas of focus for the council going forward, and that is one, is to try to make sure that our professionals become better skilled at understanding and effectively applying behavior change science when working with their clients.
Great point. When I was running facilities, ACE was one of the organizations we held up because of all of the resources you provide. And one of the ones I loved that was maybe 10 years ago, when first started really pushing my staff to look at the health coaching,
Mm-hmm.
because a lot of them as exercise physiologists and trainers had the exercise side down, but that I knew was the next frontier. And I'm glad to hear you say that, because and especially in the medical fitness industry, I think partnering with hospitals and folks are really needing to do that. I want to go back though. I really want to point something out that I liked that you said. You talked about the continuum and performance on the one end, and that people's goals are different. Everyone's goals are different, and so whatever performance that may be, it may be sports, but it also
Mhm.
may be activities of daily living that is
Exactly.
them.
Mhm.
And so what it reminds me of, and since you both are Penn State guys, and I'm Ohio State, here we are, we're recording this here at the very beginning of college football season. We'll probably drop it somewhere in the middle, so we'll see what happens between our two teams. Very good two teams, I would say. But anyways, I remember when I was in exercise science school at Ohio State, and one of the first classes we took was talking about some of the behaviors and why people do this. And in your early 20s, it's about vanity a lot of times, and
Mhm.
and
Mhm.
and to a degree, maybe it still is throughout a person's life. But as students go through, vanity and maybe sports performance and things like that, that's their focus at that age a lot of times. And so I got the opportunity to work at a medical fitness center. A lot of our clientele was not the younger crew, and so you ended up learning what is different for somebody as they age. And so it's real interesting, and I'm glad you brought that up. The other thing that I want to make sure our listeners, I wrote this down, what you said. I love this quote. I'm probably going to use this somewhere. You said optimal healthcare is the ultimate team sport. I think that just really sums up, some of the holistic nature of
Mhm.
what you're talking about.
Well, thanks, David. Feel free to use it anytime you like.
All right, I would like to, we've been talking about your background, and I actually want to dive even deeper into your background, if you don't mind. Before we
Sure.
hit record and started this episode, we were talking about this a little bit, uh, and I just feel like, well, I don't feel like, I know for a fact that you could probably go on for hours on end about your career path. And you, as you mentioned, it's not just the American Council on Exercise. You're doing so much, like with the World Health Organization, Center for Disease Control, etc. And you know, so I'm just curious, not only for myself, but for the listener's sake as well. How did your rise to these leadership and advisory roles come about? In other words, was there a breakthrough moment or a breakthrough period in your career? And and what else could you share about your extensive background with our listeners that would provide some golden nuggets?
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. If you'd like to hear more from Dr. Cedric Bryant, he'll be presenting the keynote address at the Medical Fitness Association's annual conference this November 19 through 21 in New Orleans. Don't miss this great opportunity to hear from and network with leaders in the medical fitness industry. For more information about the Medical Fitness Association's annual conference and to register, visit medicalfitness.org. That's medicalfitness.org.
Oh, well, it's probably going to. I think it shocks most people because a lot of people think that you know you have. I had this well orchestrated kind of plan of attack for my career, and I've got to be honest that I am not uh, the typical kind of goal setter that I want to accomplish XYZ. My basic approach to life, both personally and professionally, is to try to uh, make each day its own masterpiece, if you will, and take advantage of those 24 hours that God has given me for that day, and try to make sure that I'm focusing on the right things and approaching those things with as much excellence as my capabilities can provide, and just keep stringing those together. And over time, they'll result in something meaningful. And that's what I've been able to see. And I think it's being open to taking what could be perceived as risk, because I think far too often people talk themselves out of opportunities and things because either they don't feel they have enough experience, or they've got to make a change in something to go that route. And I've always been pretty open to always considering the opportunities and not talking myself out of things. And so, like, for example, the move from Arizona State to Stairmaster, I think a lot of people, it'd be easy to talk yourself, because I was very comfortable. I had a research grant that I was working on. I loved my colleagues that I was working with, but I was intrigued, and I was like, you know what? I I don't want to. I never want to live with regret. And so I have tried things, and those things have resulted in the kind of next opportunity, that next thing. And I think probably what's helped me in having that attitude is, back when I was in Happy Valley, working on my master's, there was a speaker who gave reference to a sociological survey that they did at the University of Pennsylvania, I think back in the late 60s, early 70s. And they asked a single question to, it was about 50 or 60 folks above the age of 90. And they asked those people, if you could live your life over again, what would you do differently? And a myriad of answers came back from those folks, but there were kind of three emerging themes that came through. One was that they would reflect more. They'd take time to think about those things that are really important in life and not be so distracted by the noise. The second one is that they would risk more, because what these folks had the privilege of in hindsight is seeing that they all those things that they thought, boy, I can't try this because this might happen, this might go wrong, are the things that they actually had regret in not pursuing. And in those ones where they went for it, even if it didn't go exactly as planned, there was something to be learned or gained from that. And so they were encouraging people to learn from them and take those risks. And then the third thing, just for the listeners' benefit, is that they would do more things that would live on after they were gone. And they were thinking at that point about a legacy. What can you leave for those behind you? And I've always have kind of taken that little segment from that talk that I heard, and I try to live by that.
I have I think it's a somewhat related question for you. Another thing that we were talking about before we hit record is I was mentioning that Bill Kramer was my academic advisor at Penn State, and one of the things that he talked about as far as being successful in your career, yeah. Again, this is undergrad. I didn't know, what should I do as far as going on to grad school, etc. And he said to me, if you have the time, desire, and finances to go on to grad school, you just should absolutely do it, because not only for the knowledge and the skill set, but also it will likely open up doors that you're just not aware of. And
Mm-hmm.
now I'm almost 30 years in my career, or approximately 30 years, and he was exactly right. But he said, but what's really going to make you successful in life is networking, networking, networking. Now, I know what that, or at least I feel like I know what that means now. But back then, I was just kind of this ambiguous word, and I didn't
Mm-hmm.
know, what does it mean to network. So now that's my question to you, like, what, because that obviously has played a big role in your career and your path. And so, what does networking mean to you? And
Well, I think networking is really about creating and establishing a diverse set of relationships. And and it really it's a two-way street as well. And I think oftentimes people think, well, I want to grow my network so that I can, leverage and use those individuals, but you have to give back as well. And I think because we all have a responsibility to those who have gone before us, as well as those who are coming behind us. And I think it's in that kind of networking community that we can achieve our best results. And that is, if I've had a personal frustration in my career in our space is that we don't recognize who our true competitor is. We have the various acronyms that represent the different fitness certification organizations. We have, various groups that we might look at each other as competitors. And I like to think about, and I refer to those folks as our peers in the peer groups, because our competitor is physical inactivity. And if we all recognize that and would come together and collaborate and use our collective networks in a real kind of focused, all together fashion, then we could have really significant impact. And that's why initiatives like the Physical Activity Alliance are so important to me. And I'm so excited about it, is that we really are bringing together all of these various groups within the industry and adjacent to the industry to really focus on advancing the profession, advancing the connection with healthcare, which are, I think, the things that are going to be important if we're going to continue to grow and thrive as an industry.
Yeah, I love what you guys are talking about with networking. I think that's, in my career been so important. I commonly tell people, get involved with something, and
Mm-hmm.
you need to put in effort, but you'll probably get the output will be maybe even more,
Mm-hmm.
in a variety of ways. And so I agree. You gotta do things, but from that networking, from the efforts that you put in, I think that's just the output seems to always return more. And so
Mm-hmm.
love what you're saying there, and I love you have a ton of great quotes here. I mean, our competitor is physical inactivity. Yeah, exactly.
Mm-hmm.
There's,
Mm-hmm.
that's just great. But um, Cedric, you mentioned how you're going to be speaking at the MFA annual conference this November. You'll be giving our keynote, so thank you for
Thanks.
that. We're honored and excited to have you there. The title of your presentation is "The Art and Science of Effective Exercise Programming" that you alluded to earlier. So, without giving away too much of the presentation, because we still want people to come and hear the whole thing. uh, can you give our audience, our listeners here, some of the key points that you're going to talk about in that?
Sure. I'm going to really be kind of focusing on balancing between what I kind of call the art, kind of that experience intuition side of things, and the science, which is the research and kind of evidence-based practices. But really, effective programming starts with knowing your client, their goals, their preferences, their fitness level, their health status, how you best communicate with them. And really, it's starting to have a discussion around how do we start to integrate smart, implementable behavior change science to that whole process. And the other thing too is that I think we want to make sure that the programs are comprehensive. And I know, and it is one of the reasons why I have a particular fondness for Jeff, is that a lot of times I think we ignore the importance of resistance training and balance training and those types of things, and we get so focused on cardiorespiratory training, which is super important, but you've got to have that full balanced program, and there's evidence and there's science for how you best provide that depending upon where in that continuum your client is. And I think it's important to particularly to make sure that the young people understand that, because I think we tend to see people again in either camp, and depending upon your age, one you might be wise to emphasize more, but you shouldn't ignore any of them. And I think one of the things that I see, particularly as I get more more gray and older in my peer group, is that a lot of folks my age came up in the era of where it was all about cardio and the aerobic side of fitness, and a lot of my friends in the peer group, they've only focused on that. And I see the significant losses in their functional capabilities because of their ignoring of resistance training and strength training. And my little kind of personal mission with them is to introduce them and get them to start incorporating that. And they're amazed to see the difference that it makes in their lives in a real sense. And I think it's incumbent upon us to make sure that we're kind of selling the whole message of what programming should look like.
Yeah, I would like for you to know, Cedric, too, because you see me through social media and stuff like that, and I know that it could probably be easy to form. And I'm not. This isn't towards you. This is what I'm getting ready to say is just general. Jeff's this resistance training guy, but I just want to make it clear that I'm actually the whole continuum guy. And
I know you are. That's why I appreciate what you do, because
yeah,
you don't even though I know that on a personal level, because I see so many things that you're a strength training guy in that sense. But what I love is that when you're teaching the world, if you will, you're an all guy, and that's what we all have to be.
absolutely, exactly. And I kind of look at it as maybe a goofy analogy, almost like burners on a stove, and you kind of want them all burning, but it depends on the person and what's important to them and what they have access to, and etc. But you want to kind of have all the things burning, but you might raise the burner up on one and lower the burn on another,
Exactly.
etc. But
Yeah.
you got to have them all going. So
Yeah, and a
ideally,
good friend of mine, Wayne Westcott, I think he has a nice analogy to help people understand the importance of muscular fitness. He says, think about you have an automobile and you got your engine, which powers you to the car to move, and you have the fuel pump system that provides the
yes,
energy to allow that engine to move. He goes, your muscles are the engine and your cardiovascular system is that fuel pump.
love it.
Do you want a car that has a great fuel pump but a lousy engine? Of course not. And it should be the same thing with the human body.
Exactly. Hey, I'd like to, if you don't mind, go back. Sorry, David, go ahead. Sorry about that.
No, I was just going to continue the analogy. You don't want to put junk fuel in your car either, right? So we can take that analogy real
Yeah,
far.
that's a great extension. Yeah, that's really
You got to do your tune-ups. You got to do everything. So
that's right.
I love it.
And you got to let your car have some restorative sleep every once in a while. You don't want it always running all the time. So wow, we can use the car to just get into all the pillars of lifestyle medicine.
Yeah.
Your car might want a nice little friend sitting next to it for a social connection in the garage, and all that stuff. Anyways, if you don't mind, I'd like to just go briefly go back to you mentioned the Physical Activity Alliance, and you're on the board of directors, and as you know, and hopefully our listeners are listening to all our episodes, so they know that we've had doctors Amy Bantham and Laurie Witzel, and we've had Mike Stack on, but and talking about the professionalization of the fitness industry. But I'd really like to hear your perspective. Now, you alluded to this a little bit earlier, but maybe you can dig a little deeper into this. Your perspective of the movement to professionalize the industry, especially in light of previous conversations you and I have had back in my those ACLM days when I was chairing the Fitness and Medicine MIG, about all these various entities that you again alluded to minutes ago that make up the fitness industry. How do you think that we overcome the lack of standardization so that we can successfully move the Physical Activity Alliance's plan forward, and what role will the American Council on Exercise play in this?
Sure. Well, the professionalization of the space is critically important if we're going to realize those things that I think are a desire of most folks who are connected to the space, and that is wanting to have more respect, wanting to be a part of the healthcare continuum. Unless we professionalize the space, the likelihood of those things happening are very low. And so, one of the things that we did back in 2017, we commissioned a project to try to come up with, it was called the Prescription for Physical Activity. And what it was is that we were trying to come up with a strategy map for how we could better connect the fitness industry to the healthcare industry. And we knew in order to be able to do that, we just couldn't have a meeting among ourselves. And so we had payers, we had physicians, we had medical associations, and a number of the fitness associations, and we came together and we applied the strategy planning technique, theory of change, where we started with what our ultimate hope for outcome would be, and then we worked back and said, in order to get to this ultimate outcome, these things have to happen, and they have to happen in this sequence for us to realize this outcome. And the outcome that we're looking for is that we would get more than half of the population meeting the activity guidelines, both from a cardio and a resistance training perspective. And so in order for us to get there were so many different kind of chains in this pathway to get there. You had education and training, both on the fitness side and on the medical side. We had policy. We had things like informatics in terms of making sure things are embedded into the EMR systems and so forth. And so all these chains, and what we found, there's what we came up with, there's certain things that kind of serve as a trigger or a catalyst for starting movement toward that ultimate goal. And one of them was really being able to affect change as it relates to policy. And that's really what kind of helped to birth this movement toward the PAA. And the PAA with and Lori served on that physical activity, that prescription for activity task force. Lori served on that as one of the executive committee members as well. And so what she's done is she's taken that and now she's put that into action in terms of helping to provide leadership in the formation of the Physical Activity Alliance, which is looking at trying to get assessment and prescription embedded into the healthcare systems to be able to create policy change that's going to help facilitate and support physical activity being more accessible for larger numbers of folks, being able to change the narrative and perspective that the healthcare profession often has with regard to the fitness profession, because unfortunately, we sometimes get judged by our worst examples, by those on the outside. And that was one of the eye-opening things for us in that prescription for activity task force, is that many of those medical groups, because we had folks from the AMA, we had folks from CDC, WHO, AHA, and many of those folks didn't have the healthiest opinion of the fitness profession, because they oftentimes, what gets attention are our worst examples, unfortunately. And so one of the things that, when posed the question, would you feel comfortable referring your patients to an exercise professional? I'd say the vast majority were not very comfortable, because they didn't have a high degree of comfort that those individuals were appropriately vetted and screened to provide safe and effective programming for their patients. And so that's, one of the things that you have, the Coalition for the Registration of Exercise Professionals, where it is a directory of those individuals who have gone through an appropriate vetting and assessment process of their competence and ability to provide good exercise programming. So it's all these pieces to try to solve a multifaceted, challenging problem that we're trying to address. And I think the PFA, because they are very inclusive in terms of the member base and representing, I think, all of the key stakeholders, I'm pretty excited, and I'll say cautiously optimistic, just because we know how challenging these things can be, that it is going to actually move the needle.
I'm
Yeah,
going to
I'll tell
quickly
you
ask do you think, go ahead, David.
well, just on the Physical Activity Alliance, the last fall was the first symposium, and
Mhm.
I had the opportunity to attend that, and you're right. There's so many different groups coming together. I thought it was fantastic, and we're doing another one here in a few weeks.
Hmm.
That I can't wait to see how things progress. So I think they're definitely a group that Medical Fitness Association wants to keep a strategic partnership with. And you mentioned CREP, and it all comes around. We believe the medical fitness model that we have, that with that
Hmm.
professional staffing is such a huge component of it, and it's really a differentiator. But it does allow some of that trust to be formed with
Exactly. Hmm.
healthcare providers, um, but even with others in the community and so forth. But I appreciate what you're saying on that. Go ahead, Jeff.
Yeah, I just want to interject and say one thing, and it's loaded, so you can either respond or you don't have to respond. I just can't hold back on this one because everything that the PA is doing and setting up, the policy changing and the framework is just absolutely amazing. One thing that frustrates me a little bit, and it reminds me of conversations. I don't know if you remember these conversations because it's been, at least 4 or 5 years, but we've had a couple conversations on the U.S. Reps registry, and to do a real quick compare and contrast from a clinician standpoint, and you go to that registry. So let's say you go to U.S. Reps versus you go to the American Council on Exercise registry.
Hmm.
And it's just not even close. Like the way I look at it is the American Council on Exercise registry is really sets the model of what a clinician wants to see. They want to see a headshot. They want to see a bio. They want to see the demogra the zip codes that you serve and your experience and what certifications you hold or specialty search or whatever. So it's so much more. American Council of Exercise has so much more of the information, and to me, it's a lot more clinician friendly. Whereas with the U.S. Reps, you click on it, and it's just not. I'll just leave it as it's not enough information. So my view is that I love the fact that we have this huge registry. Obviously, it's gargantuan, but I personally just wish that that we would bolster the what the registry looks like so that when a clinician clicks on it, they're seeing
Hmm.
something at least along the lines of what you're doing at the American Council of Exercise. So I'm going to leave it as a comment. You can either respond or not, but I had to.
I do have a quick comment there, Jim. Well, first, thank you for the kind words regarding our finder trainer register. The one thing we do have to keep in mind is that this year we'll be celebrating our 40-year anniversary. We're the CREP is 11, 12 years old.
You got the
So
benefit of
in
time.
Yeah, so in fairness to them, it does take time to develop things that are that robust, and it also takes resources that a relatively new organization doesn't have at its disposal. But I would say over time, you'll probably see that register look more like what you're referencing.
Good, good.
Jeff, in the interest of time, I want you to ask your next question, if you would, please.
Sure. Yeah. Okay. So as we wrap this up, um, you have recently graciously agreed to present to my movement science students at the City University of New York, or CUNY York College, in Queens, New York this fall, which is just, as I mentioned, it's going to be a treat for me. It's a treat for the students, and it's a treat for our institution. And you mentioned that you could speak to them about opportunities within the current fitness landscape. So could you provide our podcast listeners, many of whom are fitness professionals, with insight as well, maybe also to the landscape that is and opportunities within it, maybe also as it relates to collaborating with healthcare providers?
Sure, I would say first and foremost, you we touched upon it before, is that networking word is to basically make as many connections, and I also encourage people to be lifelong learners and to look for every opportunity to learn and grow. And one of the things that I don't see young people do as much as I would say I saw in the past is being willing to volunteer and to allow yourself to become exposed to a lot of different environments. Everyone wants to get to the end without making the investment along the way. And to me, it's just like training. I mean, you've got to put forth the effort, and sometimes it requires that you might, let's say you're interested in perhaps physical therapy as an example. Why not go to to a physical therapist in your area and ask if there are there any opportunities for you to volunteer, to learn, to get some insights in terms of what that profession is like. Because one, you're going to learn if that truly is a fit for you. The other thing is that you're expanding and establishing your network. Because I know just personally, I thought I wanted to be a physical therapist, and I don't want to offend the physical therapy world, but I volunteered at a physical therapy thing at a VA hospital, at a VA facility, and it was just amazingly boring to me. It didn't fit me, but I would have never known that if I hadn't volunteered. And I think so. My message is to experiment, to volunteer, to network, but learn, and there's so many opportunities to learn now, because I think by listening to your podcast is an opportunity for them to learn and get and gain insights and can help give them important guidance and direction on how to move forward. So to me, it's about learning and experiencing and committing to putting in the time.
This is really along the lines of what I'll tell my students. I'll tell them very similar things, and I'll say things like, get involved with organizations too. So you hit obviously
Exactly.
hit on that, but getting, like, for instance, the Medical Fitness Association, and go to conferences, and first just go there to hang out. Just even if it's just to hang out, and don't put pressure on yourself or anything like that. Hang out, network, get to know people. The next thing you know, you might be added to a work or an opportunity to be on a working group or a committee or something like that. So, and some of it has to do with time too. You got to get,
Right.
if it's your first day out of college, versus your 10 years into your
Mhm.
career, might make a little bit of a difference. But yeah, that I absolutely love it.
Yeah, the concept of lifelong learning, I think, I hope it's not getting lost, but I believe in it so strong. I have a little anecdote that I like to say is, a CFO and a CEO are talking about, budget for continuing education for staff, and the CFO says, what if we spend all this money and these employees leave? And the CEO responds and he says, what if we don't and they stay?
Stay. Exactly. No, that should be the mindset. Yeah.
Yeah. Well, thank you, Cedric, for all the insight that you've had. We really appreciate you being on this episode. I can't wait for the listeners to hear it, and I can't wait for you to give the keynote presentation at our Medical Fitness Association conference this year. So, thanks for being on today.
Well, thanks for having me. And again, I applaud you and Jeff for all that you do and contribute to our industry, because it's collectively we make the greatest difference. And I just appreciate, I mean, over the years, MFA and ACE, we've been great partners, and it's always been just mutually beneficial.
Cedric, before we log off here, do you want to put a plug in, like, how our listeners can either follow you or for ACE, or whatever you want to plug?
Sure, I would say that the simplest way, because you can follow me on ACE, is just to go to the ACE website at acefitness.org.
Okay, great. I look forward to seeing you in New Orleans, and seeing you in person, and just hound David on how great Penn State is and all that stuff. So I want to be able to.
Hopefully we're not going to be humbled this football season, Jeff.
Yeah, exactly. Thanks so much. I really appreciate it.
Hey, my pleasure. Thank you. And David, I'll see you in DC at the PAA symposium.
Yeah, absolutely. Look forward to it.
All right.
All right.
All right. Take care.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.